we have with us Massachusetts College of Pharmacy, Health and Science University, MCPHS. It is located in Boston, USA. And with us, we have Mr. Akash Bablani. Akash, you there?
Yes, Richard, I'm here. Thank you so much.
Okay. I'll just to give a brief about Akash. Mr. Akash Bablani is from New Delhi, India. He completed his bachelor's and master's degree in commerce from India. He is an international education professional with 12 plus years of experience in counseling students from South Asia to get admission in various universities abroad. At MCPHS, he is responsible for helping students from South Asia reach their academic and professional goals. At MCPHS, he helps Indian students connect with American and Indian healthcare industry professionals. He travels all over India to meet students and family to assist them with any queries. Akash, welcome to Student University Webinar 4. And he'll be taking a very, very important question, which is very important in this pandemic. What are the various career opportunities in health science, and what are the important factors to be considered when choosing an international program in this field? I'll just repeat the second part. What are the important factors to be considered when choosing an international program in this field? Akash, the stage is all set for you. Please take it over. Thank you very much again.
Thank you. Thank you so much, Richard. I would like to share my screen, the presentation that I have for you all today. Richard, please let me know if my screen is visible.
Yes, it's visible.
Okay, perfect. So, hello and everyone. This presentation basically has been designed for you all if you are interested in studying in the United States in order to become an American healthcare practitioner. So to start with, my name is Akash Bablani, and I help international students like you who want to succeed in a healthcare career. I will help you to ask the right questions today and will help you to get the responses that are specific to you and your ambitions. All right, so an overview of the healthcare industry. So you all want to study healthcare in the United States, if I'm not wrong. Your idea of what that includes might be very different from what your family is thinking, or maybe which is completely different from the reality. Now, why I'm saying that it would be different from the reality is because the first thing to know is that the healthcare industry in US is completely different. Now, when I say it's completely different, you might be thinking that the studies are different. Of course, yes, you're right. Healthcare studies are completely different. But that's not all. The industry itself is so different. For example, in the United States, the industry is what we call the patient-centered. Or in other words, the goal of the healthcare practitioners is to provide the best individual care possible. Contrary to India, where the priority is to try to give the care to the highest number of patients as much as possible. As in US, we are focusing on the quality, whereas in India, we are focusing on the quantity. It does not mean that we are ignoring the quality, but yes, the focus is completely different if we compare the two countries. Now, in other words, as an American healthcare practitioner, you are not only expected to be a provider for your patients, you are responsible for a number of other entrustable professional activities. So at MCPHS, you will be trained on the various competencies necessary to become a comprehensive healthcare provider and make an impact, a real impact in this new world that needs more healthcare heroes. But you can only do this in the school that pays attention and knows who you are and where you come from. So if I give you a complete overview of the healthcare industry, according to the United States News, the World Report, 7 out of the 10 best jobs of 2015 were in healthcare. Jobs in the top 10 include dentists, nurses practitioners, physicians, dental hygienists, physical therapists, registered nurse, and physician assistants. And there are many more within the top 100. So you just name a profession in the healthcare industry and US would have the number of job opportunities, career opportunities in that particular field. We've not even heard about dental hygiene here in India. We've not even heard about physician assistant here in India. And US has got those professions available. Okay. So talking about the popular degrees. So let's talk about the type of degrees first of all before we move ahead. So to start with, there are pathway programs, which basically refers to the basic preparation which is required to meet the entry requirements for the university. There are certain programs. For example, if we talk about doctors of pharmacy, we all know that doctors of pharmacy is something which is a very professional degree, which involves patient care. But then it is not easy to study any doctorate program in the US. So you would need a certain prerequisites. So there is a pre-pharmacy phase, a pre-professional phase in the United States, which we call as a pathway program. So it's not only applicable for pharmacy. Maybe let's talk about a doctorate program, or maybe a medical doctor, or any veterinary sciences, nursing, any program. So if a student, if an international student is not able to get a direct entry, there are various other ways which we call as a pathway. And I will be talking about these pathways today. Then, of course, we've got pre-medical degrees, wherein if somebody wants to become a doctor in the US, generally the students are not sure how to become a doctor in the US. What are various ways, what are various methods, or what are various channels through which we can become a doctor? So there are a few pre-medical degrees available in the US, which I will be talking about. Then we've got a bachelor's degree, of course, like any other country, US has got bachelor's degree, which is basically for 4 years at a college or a university. Then they also have fast track or accelerated bachelor's. Now, what is the difference between a normal bachelor's or a fast track or an accelerated bachelor? So as the name suggests, it is much quicker than a normal bachelor's. It could be a 2 or a 3-year program, but it is equivalent to a bachelor's degree. Now, not every 12th pass student will be eligible to study a fast track or an accelerated program. These are those students who've done certain credits, who've studied certain credits, or are looking for transfers, or have already done a bachelor's and then want to do another bachelor's in a similar or a different field in the US. We'll talk about those degrees also. Of course, master's degree, we all know. Generally, universities offer 2 years of master's, but there are universities which offer 1 or either 3 years of master's also in the United States. So it completely depends upon the program that you want to study. Then there are doctorate degrees. Doctorate degrees, we all understand that doctorate degrees are the PhDs, but that is not correct in the field of healthcare. The healthcare, all the doctorate degrees are not the PhDs. There are certain professional clinical doctorate programs that do not include any kind of research. Yes, that's correct. Those degrees do not involve any kind of research. So, for example, doctors of pharmacy, or maybe a medical doctor, or if we say doctors of optometry, doctors of physiotherapy. Now, these programs are the doctorate programs. These are the clinical doctorate programs, but it does not include any kind of research. Okay. Then there are research-based doctorate programs as well, beyond your master's degree, and those programs are the PhDs. So there is a difference. You need to understand a difference between a doctorate with research and without research. So that's about the programs being offered in the United States. So once we're done with these programs, any of these programs, now healthcare, it is very important to understand that any program that we study in the healthcare industry would require a certification or a registration or a licensure. Now, what is the certification, registration, or a licensure? For example, I've done a nursing program. Now, I have just studied nursing, could be a bachelor's or a master's of nursing, but I am still not allowed to touch any patient in the United States until and unless I have become a certified nurse, or I have been registered and received a license as a practitioner nurse in the United States. This is applicable for any and every program which requires a patient care. If I want to study a research-based program in pharmacy, or if I want to get into drug development, I don't need any kind of certification or registration. A degree from a university or a college should be enough to work in the United States. But most of the programs in the United States requires a certification or a registration and a license to practice in the United States. And those programs are the ones that requires patient care, where you have or there is a need to touch a patient in the US. Now, what is the process to get the registration or the certification or the license? Of course, there's an examination. US authorities, the government authorities, would not trust anybody, not even a university, that what kind of curriculum they followed, what they have taught, what kind of degree you have achieved, how much you have scored, doesn't matter to them. They would still want you to write a licensure examination before they could give you the certification. So you'll have to write, for example, nurses will have to write NCLEX, that is NCLEX. Pharmacy graduates will have to write NCLEX, that is a licensure exam for the pharmacists. Then medical doctors will have to write USMLE. Dentists would have to write something else. Physiotherapists would have to write another program. So there are certain examinations which are required for every healthcare practitioner if they are into the patient care. Once they have cleared their examination, they will be given a certification from the particular authority or the professional association of the United States of that particular department that regulates that particular profession. As I just shared the examples, if I've done PharmD, which is Doctors of Pharmacy, I have to write NCLEX exam and I will become a certified clinical pharmacist. If I've done nursing, I'll become a registered nurse, or I can become a certified medical assistant. But I cannot practice until and unless I have received that certification from the United States. That is very important. So while choosing the university, you need to make sure if the university covers the curriculum of that particular licensure exam or not. What is the success rate of that university when they are helping the students to prepare for the licensure exams? And apart from that, what is the pass rate, as in how many students clear those examinations and get the certifications, and in how much time, how many attempts? So all that data is very important when you choose a university. Because at the end of the day, what is important, if you're planning to study abroad, it is important that we should have a specific information in front of us when we're choosing the university, right? Most importantly, when the student gets a certification or a licensure to practice in the US, they actually get a temporary residency. Now, I don't want to touch that point of residency, but that is important for you guys to know that there are certain programs which do not have work permit or a stay back option in the United States. But after completion of the certification examination or the licensure examination, you get the temporary residency, which could be up to 5 years, which will give you all the rights to stay and work in the US and practice in the United States.